Don't be looking at your phone, Abantika. While
No, I'm looking at my phone because the phone has everything.
Well, yesterday Delhi gave us some good news. It reported less than 1,000 cases, COVID cases in a day, the first time in 7 weeks, if I'm not wrong.
Yeah.
But today there was some alarming news. The Sero survey results of Delhi show that almost 1 in every 4 people have actually been infected by the virus. So what is this dichotomy? What does it tell us? And what has been the centre's role as far as trying to curb the pandemic in the national capital is concerned? We are sorry about the delay in beginning this. Abantika, who tracks health for us, was at the health ministry briefing, which was also on the Sero survey. And then, of course, rains have wreaked havoc in Delhi. So you were caught in a jam for how long, Abantika? 40 minutes?
Yeah.
Okay, so let's get to the point. First, let's talk about what does 1,000 cases a day mean? Does it mean that Delhi has plateaued? Does it mean the curve is flattening, or too early to say that?
That's the question we asked at the briefing right now, and we were told it's too early to say because the Sero survey shows 77% of Delhi's population has still not been exposed to the virus.
Right.
So that is ripe, fertile ground for the virus to spread new infections, right? So it's a little too early to say also because if there is one thing before, I mean I'm jumping the thing a little bit. If there is the survey basically shows, the Sero survey that has come today, it shows that 23.48% of Delhi's population had been exposed to the infection.
Nearly 1/4.
Nearly 1/4, and this is, so antibodies take 14-15 days in the body to be formed. This sample was taken between the last was basically 10th of July. So this was taken between 27th of June to 10th of July. So what we were told is this reflects the situation of 18th, 19th June, which means it's more than a month now. The numbers would have gone up. Now, why it is also worrying is because this means by this standard, a city of 2 crore should have 47 lakh cases.
Correct.
Now, why I'm saying all this from your 1,000 case is that what it has certainly shown is that we have missed some 44-45 lakh cases. That means our testing is not enough.
Correct. So the numbers don't tell the story.
Numbers, your daily numbers can make you happy at times, sad at times, but they may not even tell you a fraction of the story.
Right.
That is the big lesson from this Sero survey, and that is why it is worrying. Also that, you know, these many cases being missed is, one case being missed is not one case being missed.
Right.
One case being missed is several other cases happening because of that case being missed. So it's again today they denied community transmission, but this is classical community transmission. You don't even know that this one person is positive.
Right, and where that one person has got it from.
So the thing is, you cannot by any means test all the people, catch all the people that caught that infection from, because you don't know him in the first place, him or her.
Right. But Abantika, my question is, surely, you're right that the serological survey, it's a wake-up call. It tells us that we don't even know if the numbers we are getting are accurate, what story they tell us. But keeping that in mind, assuming that the numbers have been less than what the actual story is, what the actual number of cases are, even then the numbers being less than 1,000 as compared to earlier, does that come as a positive development? Because obviously...
Yes, certainly. Right now it is a positive development.
I'm just looking for some good news.
Yeah, right now you can feel happy. So also yesterday I think Delhi tested a lot lesser. Delhi tested about 11,000, if I'm not mistaken. Between 11 and 12,000 yesterday they tested, and they were normally testing 25,000.
So that's half, almost, less than half.
Yeah, so that you can feel happy with this proviso that this is also with decreased testing.
Tests.
So and this happens every time. Weekends there is usually a dip. It just so happened that yesterday was also the weekend. The testing dip happened and the positives happened. So I would say we should just look a little bit
we
For
are
a few
wary
more
about
days,
trying to celebrate so early.
Yeah.
Right. So Abantika, what did the health ministry have to say in the briefing right now, because it was around the Sero survey?
That's right. So they actually, so the Sero survey, that one figure, there are some other figures that they gave out which are very interesting figures. So there are in Delhi there are 11 districts.
Right.
And these are the Sero survey results from all the districts. So I'll just read this out. Southeast is 22.12%, Shadra is 27.61%, Northwest is 23.31%, New Delhi is 22.87%, Central 27.86%, that's among the highest, Southwest is 12.95%, Northeast 27.7%, second highest, East is 23.9%, North is 25.26%, South is 18.61%, West is 19.13%. So basically, nowhere in the city is the prevalence except Southwest, where it's 12.95%. Yeah, it's mostly about 20% everywhere. So that's a lot of numbers.
So it's spread out. It's not as if it is contained to a certain district or a certain area. Right. So Abantika, should we start taking some viewer questions? Yes. This one is from Parimal A. Is the serological survey reliable? As Dr. Beda M. Stadler wrote, if the antibody is already present in many people, won't it inflate the numbers?
Sorry, no, I didn't.
Let's just take the first part. Is the survey reliable?
Yeah, this survey, so it has been done by the Apex Infectious Diseases Control, the National Center for Disease Control. So these are epidemiologists who deal with infectious diseases on a routine basis. Also, what I want to highlight is that the earlier ICMR study survey, that Sero survey that we were talking about, where they said 0.73% prevalence, there they had taken about 26,000 samples over 65 districts in the country, and here we are talking about 11 districts, tiny Delhi districts, where they have taken 21,000 samples. So that in a sense, that is a far more representative population than the ICMR survey, because the ICMR survey was far wider and those are much bigger districts.
Right.
So yeah, I would say yes, it is reliable.
Right. Chirag Bindal, isn't it a good thing, because this means we are getting much closer to herd immunity with a very, very small fatality rate, assuming there is no underreporting of deaths?
There is one issue here. If we have missed this many cases, we would have also missed some deaths. That's one. However, even with these figures, the infection, so there is a case fatality rate and there's an infection fatality rate. With these figures, the infection fatality rate comes to less than 0.09% or something like that. I have to do the calculation. Delhi has had about 3,300 deaths so far. If these are the numbers, then the infection fatality rate is much lower. That's your good news. However, we don't know what percentage gives you herd immunity. We don't know which 77% has been left out, because this is, remember, this is like immediately after lockdown, so all your vulnerable populations would still have been inside. Unlocking would have just begun for about 2 weeks.
Right.
We don't know which 77% remains. A. B. We don't know how long the antibodies last, which would basically mean that is this concept of herd immunity even a concept? Do we know it works? Does it give you immunity for a reasonable period of time for you to bank on herd immunity? So these are very iffy questions, and science, frankly speaking, does not yet know the answers to these questions.
It's still an unfolding story. Nilay Ghalsasi, is a Sero survey necessary for Mumbai, Ahmedabad and all other major cities?
Completely, yes, absolutely. In fact, there was one Sero survey that was done in a containment zone by ICMR in Ahmedabad, where they got, I think, 33%, 34% prevalence rate. So yes, absolutely, in any city where cases are rising fast, there are high numbers of deaths, a Sero survey would give you an idea. But I have to also make this point that the Sero survey gives you a sort of a retrospective view your containment strategy, mitigation, testing, all of that, how much that worked. It's a retrospective view. You can tweak your future strategy according to that, but in the immediate, there is no immediate use. You know, there is no diagnostic value of these tests, antibody tests.
So it just gives perspective.
just gives perspective, just tells you, yeah, that you did this right, you did this wrong. That's all. And for example, now it clearly says that you missed this many cases. That's the one thing in bold letters that the Sero survey says.
Right.
Yeah, they need, Bombay and Ahmedabad need Sero surveys to assess the amount of spread of the infection, but whether that will have any immediate effect on the current containment and other strategies, I'm not sure.
Right. This is a question from a YouTube user. I don't have the name of the user. Does this mean that there is without a doubt community spread? So Abantika, what is this reluctance on the government's part to admit there is community spread? In fact, you had done a story about how a health ministry document mentions community spread very clearly, says it happened as early as April, if I'm not mistaken.
Yeah.
And then of course that document, this was deleted from the document. The government has been denying it ever since.
Right. So today we were told, that's the quote actually I'm looking for. Today we were told that there is localized transmission in some pockets, and we were also told that WHO does not define community transmission as such. It allows its member states to decide its stage of transmission, and on that basis we are saying that we have localized transmission in some pockets. There is no community transmission yet. This comes when Kerala government has clearly said, the Chief Minister of Kerala has said there is community transmission in 2 places in Trivandrum. And yesterday the West Bengal Health Secretary said, I mean, he did not say it in so many words, but he made it sort of very clear that community transmission is happening. Also, as I mentioned, if this many cases have been missed, there is no way you do not have community transmission. I mean, I do not normally speak so emphatically, but this number is so huge that there is no other way you can
to define it. But then again, to repeat my question, what is this reluctance of the government? Is it to also maybe perhaps not spread panic?
Yeah. So see, there is actually a lot of panic even now. You know, panic, mental health issues, anxiety disorders, all of that is happening. I think there is a thinking in the government that if you declare community transmission, then it will be complete mayhem, and people will not come out, nothing will work, and then, you know, the panic will make things much worse, and all of that, which I think is a bit late in the day sort of to take this stance, because I think right now everybody in the country believes it's happening.
Right. And I think the panic that had to set in had set in. Now people are slowly returning towards normality in any case.
So I mean, we live with many diseases, and I'm beginning to think maybe we'll also sort of
learn to live. And now there's good news on the vaccine front. Well, of course, a long way to go, but there is still good news on the vaccine front. Akarshit Arora, does the result of the Sero survey indicate that lockdowns have failed? Now, this is an interesting question because, you know, does it tell us, what does it tell us about lockdowns? Does it tell us they were successful? Does it tell us the virus has been indifferent to it?
What we were told right now by Dr. V.K. Paul, who's a member of Niti Aayog, was that these results show that the lockdown was successful. However, to assess that, see, there were a lot of studies which came initially in March, April, which the government rejected at that point, which said millions of cases and, you know, huge numbers, huge deaths. All those surveys were rejected. Now, if you have to say lockdown was a success with 40 lakh cases, 46, 47 lakh cases in Delhi, you have to say if lockdown was a success, then you also have to admit that
it could have been much more.
Those studies then that you rejected, that you sort of vilified those epidemiologists, then you have to say that those studies were correct because this is your number. So Manish Sisodia, the Deputy Chief Minister of Delhi, he's being constantly, even now, ridiculed for his statement that there will be 5.5 lakh cases in Delhi by July end. What number do you have now? It's so I think the government's stance on lockdown has been a little slightly opportunistic. You know, there is this constant need to validate the lockdown.
Well, it's also a political question, Abantika. I mean, the government can't quite afford to sort of show that it hasn't, you know, its decisions have been or have not helped. So
it is, but the problem is science doesn't wait for politics.
Sure. Unfortunately, that's not how political parties think. There's a question from Sundar S. Is India's following the global standards in terms of sero surveys or other methods to identify community spread of COVID? I think you answered a part of it when you said that WHO doesn't quite define, that's what the government stand is.
Yeah, government stand is, but WHO does define actually. WHO's website clearly defines what community transmission is. And so basically, like we mentioned, community transmission is defined as something that seems to have happened if you don't know the source, if you don't know the chain of, if you can't link, sort of identify every link in the chain of transmission. But I don't think the methodology of the Sero survey is in question here. I mean, if this is a wrong survey, then I don't know.
Right. Very quickly, Abantika, before we close, there was a time when Delhi clearly seemed to be slipping into some kind of an abyss. Then the Home Ministry stepped in, Union Home Minister Amit Shah personally took charge. Has there been a positive movement in Delhi as far as curbing the pandemic is concerned since the Home Minister, since the centre stepped in?
The Sero survey actually was planned after the centre stepped in.
Right.
This is something that this is come from the Home Ministry. This is that's one. Delhi's testing has gone up much more. You know, beginning of June we were doing about 9,500 tests. Now, if you just reject yesterday as a blip, 11,000. We're usually doing 25,000, 24,000, 25,000 tests. Though about 3/4 of that is antigen tests, which is another story. But Delhi's positivity is down. At that point of time in June, the positivity was insane, 30%, 35% positivity. Now it's way below that. It's around, I think, 8%, 10% positivity. The cases, like you mentioned, they are coming down clearly. So yes, Delhi has certainly moved a lot in the last 1 month. But there was a question today about whether Delhi is past the peak, and the clear answer was we can't say. We can't say because 77%, like I mentioned, 77% is still not exposed.
Right. Well, Delhi may have recorded less than 1,000 cases yesterday, but as Abantika pointed out, the results of the Sero survey do prove as some kind of an eye-opener. So there is no space for smugness, no place for complacency. Very important to continue following physical distancing norms, to keep wearing masks, to constantly wash your hands and sanitize them. But of course, no need to panic, as we've been saying since the very beginning. Thank you so much for watching Government Matters. Thank you for being patient even though we began late. I wanted to say don't keep subscribing to our YouTube channel. What I'm going to say is please keep subscribing to our YouTube channel. I think the virus is going to my head, Abantika. Thank you.
Thank you.